after decades as a cardiologist, I know that there's things that you see over and over again in people's habits and their lifestyle that leads to the degradation of their cardiovascular health. So what things, if you had 3 things to tell everyone that they should do in order to keep themselves healthy, what would you prescribe?
Heart healthy, right, Kyle?
Yeah.
Is that what you mean?
Mm-hmm. Yeah. Well, it's really what not to do and what not to do. Some things you can't control. You can't pick your parents, right? So if you have genetic predisposition like diabetes, high blood pressure, obesity, or high cholesterol, family history, you can't pick your parents. So if you have all that, then you just have to modify what you can modify. There are some things that are modifiable. Particular smoking is the worst thing. So if you're smoking at a young age, you're going to have a 2-3-fold risk of having a heart attack and dying way before someone else who doesn't. So that's something that you just can't do. Of course, there are people who smoke and live forever, but those are the exceptions. So we look at it in terms of the cumulative effect of multiple risk factors. So things you can modify are your blood pressure, because you can take medicine, you can lose weight, you can exercise. If you're obese, these are things you can modify. And of course, don't smoke. If you have diabetes, keep it under control. Family history, you can't change. High cholesterol, you can. There's medication for that. So it's really an awareness of what those risk factors are and modify what you can modify within reason. The corollary to all that, of course, also is public awareness to make sure that you know what the warning signs are. And you guys are young, you don't have to worry about it. But if you are in your 50s and 60s and you have a lot of those risk factors that we just talked about, you're at a much higher risk for having something bad happen. So that's where public information becomes important. And as patients, you have to be an active participant in your healthcare. So understand what those risk factors are. Even in 2021, I just had a patient the other day who was having symptoms for 3 months, and you just have to ask, what were you doing? Did you tell anybody? No. Mm-hmm. Well, he was lucky he didn't have a heart attack, but he was heading for one. So the minute that you develop symptoms, you have to know what those symptoms are. Then once they do appear, then you have to seek help immediately. Don't sit around the house.